Okay, so a couple of days ago we had an incident in the office where someone fainted. And when someone faints, it can be very... Okay, Earl, come on up. So when somebody faints, it can be very disturbing, but I want to tell you a little something about vasovagal syncope. It happens to everybody, can happen to someone for no apparent reason. Can be they saw blood, it can be that they just got too hot and clammy. So you know when it's coming on. I'm going to tell you how to recognize it and what to do. But the first thing you need to know is, the most important thing is, this noggin gets to the head, the head gets to the floor gently, so that the noggin doesn't fall on the ground. Vagal syncope. What happens is our veins dilate up, so we lose blood pressure. So we get faint, we start to lose consciousness. You may get a clammy feeling, you may get a sweaty feeling. And when you feel that coming on, you shouldn't ignore it. What you should do is slide down, so you get your head down on the ground safely, so your head doesn't fall and strike something. That's the most important thing. Then once you're on the ground, can we get you on the ground?
Getting on all the way?
All the way. So the next thing is to get more blood to the head. So we get the legs up, because the blood will then flow back into the body and be able to be pumped to the head. Then the next thing is we want to turn the head to the side, so that if the person happens to vomit, any vomit comes out and they don't aspirate or inhale it, which is very dangerous. And then we want to make the patient comfortable. You can open up the clothing a little bit. You can take a moist towel so that it cools them a little bit and reassure them that it's going to get better in 2 to 3 minutes. If a lot of people are crowded around, you push the people back so they can get a little air.
Crowd control.
We don't want to cross the legs. We want the legs uncrossed and the legs up a little bit. And then you'll regain consciousness. That's vasovagal syncope. In the next video, I'm going to tell you how to tell the difference between somebody losing blood pressure for another reason and just vasovagal syncope. You can get up. Thank you so much, Bridget.
Of course.
And no, I don't think the floor is clean.